Hello, my name is Maram Al-Haj Ahmad. Welcome to episode 2 of FIP's CPD series titled From Prescription to Over-the-Counter, Pharmacists Ensuring Safe and Effective Pain Management. This episode will focus on essential advice on OTC analgesics. In this episode, we will be using a role play to guide your learning experience. This interactive approach will help us understand the practical aspects of our roles as well as share key information to support your role as advisor to your patients. Following watching this video, you will, through our interaction with Maria, our patient for today, we will demonstrate how effectively guide patients through their medication changes, ensuring they feel supported and informed. We will assess Maria's health profile and explore how to select appropriate medications based on a comprehensive understanding of her needs and potential drug interactions. We will focus on how to communicate effectively with patients about the use and the limitations of OTC analgesics, ensuring they understand how to use these products. We will also discuss both pharmacological and non-pharmacological approaches tailored to Maria's specific circumstances. The contents we will cover for today are: we will start by introducing the role play and walk you through some of the steps and analysis made, including patient assessment and introduction, medication review, safety and drug interactions considerations, recommendations and considerations. Let's start by introducing Maria, our patient for today, who enters her favorite pharmacy after her minor toe surgery. After Maria explained her situation, I began a detailed consultation to assess her needs and ensure I could offer the best possible advice and treatment options. Let's explore together the steps I followed. Let's start by...
Good evening, I'm Maria. I just came out of the hospital 3 days ago for a procedure on my toe, and my doctor recommended that I see a pharmacist for that can recommend like an over-the-counter medication to manage my pain.
Oh, hi, Maria. My name is Maram. I'm your pharmacist for today. I'm so sorry to hear about your toe. Let me see how I can help you manage your pain. Can you just please tell me what medications you were on? In this scenario, I first started with patient assessment. I had to confirm Maria is not pregnant or breastfeeding because certain OTC medications and analgesics can be harmful during pregnancy or pass into breast milk. I checked if she had any allergies or is living with any chronic medical conditions, including asthma, or if she has or had any stomach ulcer. This helps to identify potential drug or disease-drug interactions with medications. I also asked about her medication history. I reviewed all medications and supplements Maria is currently taking, including over-the-counter drugs and herbal remedies. In this scenario, Maria shared that she recently received surgical treatment for a minor toe injury at the hospital. Maria still has mild persistent pain, even after completing her prescribed painkillers from the doctor. It's important to note that Maria is not pregnant or breastfeeding, has no chronic medical conditions besides seasonal allergies, and drinks coffee regularly, with a history of mild heartburn. Maria, previously treated for a toe injury with ibuprofen 600 milligrams twice daily, takes non-sedating antihistamines for seasonal allergies, and vitamin D daily. In this case, I'm confident to recommend keeping her on the same medication, but using the OTC dosage form we have available. It is in this case, ibuprofen 200 milligram. And please note that OTC dosage forms may vary from a country to another country. My consideration is that as a non-steroidal anti-inflammatory, it can effectively manage pain and inflammation, but long-term use can increase the risk of stomach ulcers and bleeding, especially with patients with a history of stomach problems. Maria can continue taking ibuprofen for 2 more days, and if the pain persists, she must consult her doctor. Let's take a detailed look at medications Maria is currently using to understand how they might interact with her pain management regimen. Maria takes non-sedating antihistamines and vitamin D regularly, which generally do not interfere with ibuprofen. Regarding caffeine, it's important to note that while many of us enjoy our coffee, caffeine can increase pain perception, potentially making pain feel more intense. This could somewhat lessen the effectiveness of the ibuprofen. To manage this, Maria could consider timing her ibuprofen intake to avoid coinciding with her coffee consumption. Ideally, separating the two by a few hours could create a more effective window for the ibuprofen to work without the influence of the caffeine. After reviewing Maria's current regimen of ibuprofen, dosed as 600 milligrams twice daily for her toe injury, I now need to make some decisions based on our consultation. If Maria has not been using ibuprofen for an extended period and she reports no stomach discomfort, we could consider continuing this treatment for a short-term period. However, if her pain continues or if there are any concerns about long-term usage, it might be necessary to adjust the dosage or the frequency of her doses. Should ibuprofen prove unsuitable, perhaps due to potential drug interactions, allergies, or concerns about gastrointestinal effects, we should look at another alternative OTC pain relief options. Acetaminophen is a viable choice, and we'd need to evaluate its effectiveness and any potential interactions with medications Maria is already taking. Additionally, we can consider topical pain relievers such as creams or gels that can be applied directly to the toe for localized relief. Depending on Maria's preferences and specific needs, we might also discuss non-pharmacological options cold, like cold therapy or compressive wraps, which can effectively complement her pain management strategy. The recommendations for Maria are ibuprofen, 200 milligrams 3 to 4 times daily after meals, and this is a lower dose than what was prescribed by the hospital. It's a very suitable option for pain relief and for inflammation. Ice pack application, rest, and activity modification.
Maram, how should I take the ibuprofen if I decide to continue on with it?
Yeah, sure. You can take 200 milligrams 3 to 4 times a day after food or with milk.
Maram, hi, thank you so much for that. And what should I do if the pain persists or if it gets worse?
If the pain persists or you have any side effects, please come back to me. But if it gets worse and it gets worse significantly, I highly recommend you go back to your doctor. Maybe you need another treatment plan or you need another investigative test.
Thank you so much. I feel so much better after talking to you and managing my pain. I appreciate all your help.
Anytime, you're more than welcome. And please don't hesitate to come back to me if you need any questions or anything I can help you with. I hope your toe gets better soon. Take care and have a great day. Bye-bye. In this role play, the pharmacist gathered a thorough medical history and tailored the ibuprofen recommendations to Maria's specific needs and risk factors. Drug interaction check, which will ensure that the recommended nonsteroidal anti-inflammatory wouldn't negatively interact with Maria's existing medications. Side effects mitigation. The pharmacist proactively addressed potential side effects like stomach upset by suggesting ways to minimize them. Patient education. Clear instructions were provided on dosage, how to take her medication, and warning signs to watch out for. Non-pharmacological options, briefly mentioning complementary pain management strategies like ice packs or rest could enhance the overall advice. Follow-up recommendations, encouraging Maria to return if her pain worsens or she experiences side effects, emphasizes the pharmacist's ongoing role in her care. In this role play,